talk with Dr. Tim Bael, who's a local physician here in Tompkins County and also in Schuyler County, and just about what we're seeing locally here with respect to patients who are perhaps needing additional care or perhaps not. What's your perspective on what patients should be doing right now?
Well, I think the number one thing that everybody can do is to socially distance, to stay home when possible, to wash your hands, and to just not get sick. The biggest thing we're looking for from every member of this community is don't be part of the problem. Keep yourself healthy, keep yourself safe, keep your distances, because this virus is going to come through our community. It's becoming more and more prevalent, and there is going to be a lot of people needing attention, and just don't be one of them.
And so you as a physician, as you're working with patients now, are you hearing concerns that they're expressing about this?
I think everybody's very worried, and I think that it's appropriate. A lot of people will get this virus and be absolutely fine. 80% of cases are mild, but others become more serious, and there's really an all-out effort in our local hospitals to be ready. We're finding places where we are going to put patients who are expecting to come in, expanding the ability to manage respiratory illness, trying to find personal protective equipment for providers, for the nurses, for the workers in the hospitals, and for the providers.
So you're getting ready. You're preparing and getting ready. What sorts of things could
We're starting to see some patients.
You're starting to
in
see
the
some
hospital.
patients.
Yeah.
You're seeing patients in the hospital. And so what sorts of resources could you use to help address what you see coming?
Yeah. I think personal protective equipment is a major issue. Hospitals really only have a limited supply, and every hospital at the same time is trying to prepare, which makes the supply lines very stressed. So anything that can be done to really booster that resource, I think will be extremely helpful.
And I saw some people calling for, if folks have decided to, have extra boxes at home for themselves for one reason or another, maybe give up one or two of the boxes and give them back to the hospital.
We have providers on the front lines who are reusing equipment that's not meant to be reused. There's different ways to try and sterilize just basic surgical masks, and any other circumstance would be a one-use and discarded item. We're going to be using items that are going way beyond what the manufacturer would ever recommend or anything that's been considered. So really, anything that people can do to help, I think, is going to be appreciated.
And what about personnel, like helping to get more nursing staff here? Could we reduce the licensure requirements, for example, temporarily for nurses, so that a nursing student could work under a certified nurse temporarily?
I think that would be totally reasonable and appropriate. I think that we're going to need nurses, just like we need providers, to help care for these patients, and we need to account for the fact that some providers are going to be contracting this and being out, and so I think that would be a great thing to be able to do, to just bring more hands on deck.
But so the message you're giving, it sounds to me, is that you said 80% of these cases are going to be mild. We need to all just do our part and stay healthy.
Yep.
Do what we can to support you folks who are in the hospitals, really on the front lines.
And the biggest thing is just follow the recommendations. Stay 6 feet apart. Stay home whenever possible. Be with your family. Be with the people you care about.
Enjoy this beautiful place we live in.
Enjoy this beautiful place we live in. And stay out of crowds.
Great. Thanks.
Thank you.
Dr. Bael.